Central line dressing change. First, confirm your patient's identity using at least 2 patient identifiers. Explain the procedure to the patient and wash your hands. You'll apply a mask to yourself and then to your patient and ask the patient to turn their head away from the site. Assemble your supplies on a sterile field. Apply non-sterile gloves. And then you're going to remove the existing dressing by lifting the edges of the dressing at the catheter hub. You want to gently pull the dressing perpendicular to the skin towards the insertion site to prevent the catheter dislodgement. After removing your dressing, you'll discard it in the appropriate receptacle. If a biopatch was utilized, then you'll remove that and discard that in the proper receptacle as well. You're going to inspect your site for redness, swelling, or any signs of possible infection. Note the catheter insertion site as well as the suture site. Notify your physician of any abnormal findings. You're going to remove your non-sterile gloves and wash your hands. You're going to open up your central line dressing kit. Then you're going to apply your sterile gloves. In your dressing kit, you will find alcohol swabs. You're going to cleanse the site with your alcohol swabs, utilizing an inner to outer motion and allowing to air dry for 30 seconds. After allowing to air dry for 30 seconds, you're to cleanse the area utilizing the ChloraPrep applicator. Break the arms until you hear it click like so, and then gently shake it to bring the contents to the surface. Using the same technique, you're going to clean vigorously using a back and forth motion. side to side, up and down for 30 seconds. Then you're going to allow it to air dry. You're going to place the stat lock. You'll remove the stat lock already in place. For the purposes of this demonstration, I'm verbalizing the removal and then replacing of the stat lock itself. Next, you'll apply a new antimicrobial disc. Then you'll apply your skin prep, the green, to the outer perimeter to protect the skin and assure that the dressing adheres. So along the outer edges of where your dressing would go, and then you're going to allow to air dry. You will then remove your dressing. You will center your dressing, making sure to cover all areas around the insertion site. You will remove the outer edges of your Tegaderm dressing, making sure not to discard your label. We'll put that to the side. At this time, we will change the blue microclave valve with a fresh one. We will remove our gloves and wash our hands. Then we will label our dressing. Please note the requirements for labeling your dressing: time, date, and initials. And then document according to policy.